Hey, welcome back to the Fit Survivor channel. So today we're going to be looking at this trauma kit that I've set up. And most of you requested this in the last video. I kind of gave you an option between this and the survival kit in a bottle. And so many of you were interested in seeing my trauma kit. I just see the approximate size. Nice thing about this bag, and this is, if I'm not mistaken, this is an Orca Tactical. It's basically a medical bag or a trauma kit bag. Nice thing about it is that you can actually attach this to your belt, okay, by this right here. Basically you can attach to your belt, or also if you are into the MOLLE system, it has the MOLLE. All right, so you can attach it to other packs or whatever ways. And kind of cool is that, I'll get into this a little bit, but that actually you can easily yank this off of your belt. All right, and so let me show you. To do that, I release this, which of course then my Bite and Sting kit falls off. And all I have to do is, okay, now this part be attached to my belt, and so I just grab this large handle, I can just yank it off of the belt. All right, and so basically it gives you kind of an easy way to open it up, or should I say take it off your belt without having to reach in the back at these clips, try to unattach them and stuff. And so that's kind of cool that they did that. It's kind of like a quick detach, I guess you could say. I'm going to put this to the side. All right, so here's the Bite and Sting kit. This is from Sawyer. And now where I live, snake bites are actually a serious thing. So that's the reason why I carry this in my trauma kit. If where you live, if you don't have snakes, or if snakes are not a big issue, then of course naturally in your trauma kit you would not do something like this. All right. So for this, what you do is you put this little suction cup on the tip. And it's kind of interesting because it's kind of counter what you would expect. You would think you need to pull out to create the suction, but instead you do just like a shot and you push down and it creates quite a bit of suction. All right, so you can see how it sucked my skin up into there. All right, and this actually works on snake bites, on bee stings. Basically, anytime you have venom from a bite, this works really well for extracting it. In this kit, there's a little razor because if, like say, your leg, if it's really hairy, then actually the hair can actually kind of cause some hindrances for getting some good suction. And so it comes with a little razor there. Got a little alcohol prep wipe here, so you can get it cleaned up before, after, and a Band-Aid. All right, so pretty good kit. I've heard some people say that it won't help with a snake bite, but I'd rather have it than not, right? All right, then the next thing on here, this is a cat tourniquet. All right, it's in this plastic bag, just kind of keep it clean, keep it safe. If I'm in an emergency, I can just rip this bag open. And so, just again, to get to it quicker. I'm gonna do a quick demonstration with this. Now, if you decide to use a cat tourniquet in your kit, I suggest getting training. For all of the medical, basically in general, I'd suggest getting some training. I got a Red Cross certification on first aid, CPR, and AED, which is the defibrillator for like restarting your heart with this electrical. Okay, if you know what I'm talking about, you know what I'm talking about. So anyways, you can go into redcross.org and you can sign up for classes. I took a hybrid class, so it's, you do a lot of the information you study online, and then you actually show up at the class, and it's like 1 hour of actually hands-on practice of doing CPR, some first aid, some basics like that. And so I highly recommend, if you have gear, if you don't have gear, I highly recommend getting those classes, because having the equipment without the knowledge sometimes is kind of useless. All right, anyways, so this is a cat tourniquet. And okay, a tourniquet, you're only going to use it whenever you cannot stop the bleeding. All right, and this can only be used on your extremities, like your limbs, okay, your arms, your legs. You can't use it anywhere else. And if you can't, okay, you got you got a lot of like profuse bleeding. You can't stop it. Well, that's when you're going to use a tourniquet. All right, it's not going to be for small bleeds. All right, so a quick demonstration I want to show you with this. It's kind of interesting. Okay, I know that, for example, for your arm, you should put this on your femoral artery, which is up by your bicep, right here, this large artery. But since I can't get that on the camera, I'm going to go ahead and do it on just my forearm. All right, for demonstration here, I'm going to snap this on. 1 second, it's reading my heartbeat. So you see there's my oxygen, and right here's my beats per minute. All right, and so I got 87 is my heartbeat. Make sure you can see that up there, okay? And now what I'm gonna do is, I'm gonna go ahead and tighten this down. Again, like I said, I know this should be on the brachial artery, but just to fit everything in the camera. All right, so what you do is you make this nice and tight as you can. Then you take this windlass, and for example, I'll just put one twist on it, which is fairly enough. All right, now slide it into here so it doesn't come back out. And now watch. If I've done it correctly, there it goes. I now have no heartbeat on this lower part of my hand. Okay, so that means that this is successfully cutting off blood to the end of my arm. And so if I cut off my hand in some kind of accident, I can do this to stop the blood from flowing. All right, now watch. I'm going to release this like that. And I'm going to loosen it up. And now watch. I now have a heartbeat again. All right. So that's the use of a tourniquet. Again, I'm going to say it's for when you cannot stop the bleed with ordinary pressure. All right, and I'll show you some other options. We're getting to my bag now. I'll go put this to the side. And also, if you noticed, in this bag, I have a Sharpie. Because what you do is, you don't want to leave this this tourniquet on for any extended periods of time. I think they say online that 2 hours is the max. But even at that, you don't want to leave it on. It causes a lot of pain. And so anyways, you write the time right there. And so if you are actually treating somebody else, then somebody else comes up and they say, hey, there's a tourniquet on here. If you have the time written down, they know how long this has been on. Because if you leave a tourniquet on for too long, it actually can cause muscle damage, nerve damage, and it can actually lead up to having to have the limb amputated. All right, so once again, I can't say enough that you really need training for all this medical equipment. Okay, let's go ahead and dive into the bag. I like this setup. It has a tri-fold. I got my mask right there. All right, and so if I'm treating somebody else, I can snap this on real quick. Well, pull it on. All right, so I have this tri-fold. It opens up, and it's kind of nice for organizing out the different medical equipment that I have. So we'll start from the top, and we'll work our way down. Go ahead and slide this that way. All right, so in the back, I have some shears. All right, and these are great for if you have a big cut on your leg or whatever, and you can't get to it because of your pants. Basically, you just cut it off. Okay, you cut the jeans off, cut the pants off. Anyways, it's for accessing the wound. If you can't see the wound, you can't treat the wound. All right, got some shears. And now this is combat gauze. This has a hemostatic, sorry if I didn't say that correctly, agents. And what it does is it almost like forces the blood to clot up and to stop bleeding, okay? So let's go, let's open this up and I will show you exactly what is inside. All right, and so you'll see how this is folded. It makes it easy for packing. All right, so if somebody has, I'll just keep using my arm because it's the easiest thing to show. If somebody has a major cut, all right, and you're trying to get to that cut to stop the bleed, what you do is you would start, basically like where you just start packing, okay? And so you'd pull this, you'd pack. You'd pull it, you'd pack. You'd pull it, you pack. Until basically you have the entire wound all packed up, all full basically, and it's supposed to stop the bleed, okay? And again, it has the hemostatic agents in there, which actually makes it better than just ordinary packing gauze. All right, so that is the Quick Clot Combat Gauze. Put that over there. We have next, also from Quick Clot, this is an advanced clotting sponge. All right, so let's open this up. We'll look at this too. All right, so what you see is it's like beads. Okay, if you can hear that. There's little beads in there. And what happens is this actually heats up also. And so you got a bleed right here. And you use this basically like you put it on top of the wound and you'd apply pressure. And it's gonna get hot. It's not gonna be comfortable, but it's better than bleeding out. All right. And so that's what this is for, is you would attach that, or you place that on the wound, you'd apply pressure, and about 2-3 minutes, and you're gonna wanna wrap it up. All right, so that is the Quick Clot Advanced Clotting Sponge. All right. This over here too. And also in the back, we'll pull these out. This is an abdominal pad, and it's a large pad. It's highly absorbent, and you use it for anything that's kind of like oozy, and it helps keep the wound moist, but at the same time clean, because it just keeps absorbing up the pus and whatever else, is basically oozing out of your wound. All right, so an ABD pad. So different sterile gauze pads, gauze sponges. Go ahead and open this up and show you what is inside. All right, so you can see it's a pretty thin, pretty simple, okay? And again, it's just for applying on top of a wound. You can use this for a smaller bleed, where you'd place it and you'd apply pressure. And basically, if it becomes saturated, you'd open another one, you'd put it right on top, you don't take the gauze off, and you just apply more pressure, and then you'd end up, what you would do is, jumping ahead here, but, for example, right here, I have the what is it called? The self-conforming, I think. Yeah. And so, what you would do, okay, so you'd apply this, let's say, on a wound, and then you'd begin with the gauze, you'd begin wrapping around, and then you would hold it in place with the gauze. All right, and so like that, you'd hold it down. And okay, and like I said, this is self-conforming gauze. And it's really, if you haven't used it before, it's really kind of really nice to use. If I get a demonstration for you here. It's always harder to do it on yourself, but nonetheless a good skill to have. All right, so as you wrap it, like this, and let's just say so much probably, right? We'll cut this off with the shears. Like that. And then all it does is, you don't need to tie it, you don't need to do anything, it just sticks to itself. All right, so for example, see there, it's loose. Just pull it, rub it down, and that's it. It stays in place. And so, really nice gauze to have. Let me go to move all of this. I've cut open now. All right, so gauze pads, the gauze sponges, they're similar to the gauze pads. Up top. All right, and then also right here, this is a CPR mask. So when you're doing mouth-to-mouth resuscitation, this is basically a little plastic guard that you would put over in their mouth, so you're not exchanging saliva, let's just say that. All right, so kind of nice to have for your own protection. All right, and so that's all for that back pocket. Right here we have a small little flashlight. This is used for gauging the pupil. All right, so this is like when somebody has a concussion or you suspect they have a concussion. What you do is you shine this in their eye, and your eye should become smaller. All right, and so if it remains large, and you can see by the gauge, if you shine light into the eye and the pupil does not shrink, that's a good indication that they have a head trauma, they may have a concussion, something like that. All right, then I have a sterile cotton tipped applicator. It's like basically like a large Q-tip, basically, one-sided, and it's good for applying some like antibiotic cream, or for cleaning out, like if you've ever had a road rash, you know how you get like the sand and the dirt in there. It's kind of good for getting that kind of cleaned out, swabbed out. And this is a tongue depressor, but I use this as a finger splint. Okay, so if you jammed your finger real bad, you broke your finger, sprained your finger, what you do is you just snap this as ever long you need. You place it behind the finger, kind of like a splint. And then again, you would go back to your gauze, and you would just basically, you'd wrap this up. All right, so it's a glorified popsicle stick, if you know what I'm talking about. All right, and then this next compartment, it's also a swab stick. This one has the povidone, iodine. It's good also for cleaning up a wound, prepping it. All right, next thing, we have Steri-Strips. If you've never used Steri-Strips, it's kind of like, almost like getting stitches without the stitches. They're supposed to be really sticky. And what you do is you'd apply it to a wound, and you can pull it shut. All right, so they work really well for basically avoiding having to get stitches. And this right here is silk braided. This is actually the surgical sutures is for doing stitching. All right, more non-adherent pads. This is good for whenever you have a wound that it's kind of got a lot of open, what would I say, like let's say again you have like road rash and you scraped away your top layer of skin, and anything you put on it sticks to it, and then when you change the bandage it pulls. This non-adherent pad is nice because you put it on there, and when you're ready to change it, you're not pulling off like the scabs and making it open up again. And so these are nice to have for that reason. This is moleskin. Whenever you have rubbing, you get like blisters on your feet, you can put this on there. It's kind of soft. It's kind of just to help prevent the pain from blisters and things like that. All right, then this is, they're moist burn pads. Now these are really pleasant after a burn because they not only do they like help with the healing, they also make it feel very nice because they are cool and they're moist. Let me go and I'll open this up for you too. Let you see all this gear. Got it going here. All right, so what you do is you peel off this section like this. And you would apply it to, let's say, okay, this is really big for my hand. You apply it like this. And so it's moist, it's kind of like a gel. And so you just put that on there. Of course, it rolled over itself. There we go. Apply this on there. Yeah, base like that. All right. So anyways, it's moist and it sticks by itself, as you can see. So it just sticks right on there. And it's really both, it's healing for a wound because it's got the moisture in it, but also it's pleasant. When you have that burning sensation from a burn, this cool gel on it is really nice to have on there. All right, toss this over here. Something I want to point out while I have this piece of plastic open, I don't have a chest seal in here. A chest seal is basically a large piece of, I'll say plastic, okay, you can correct me if I'm wrong, and it's really sticky. And so if you have a chest wound, what they call a sucking chest wound, which is often it happens from a gunshot, okay, so a gunshot to your chest, and what happens is your lungs are sucking in air through that wound. There's actually, they call it a chest seal. I don't have one, but you can actually use like just some of this thick plastic. Even a lot of people who have chest seals will use just like a plastic like this. They'll use tape and they'll just tape it to where your chest wound is, just to stop it from sucking air in. All right, and I have some duct tape in here for something like that. It's actually not duct tape, it's Gorilla Tape right over here. And so this is super sticky stuff. It'll stick to your chest even if you have hair. And so what you do is you use this and you would tape it to the chest, okay, to stop the sucking wound. All right, so some Gorilla Tape there. All right, next up, have some large Band-Aids. All right, you can see basically the size without me opening it. And again, you'll use your Band-Aid. I have a bunch of assorted different sizes, and it all depends on the actual size of the cut or whatever you have. So these are the largest ones that I have. And then this is Tegaderm film. It's a way to protect a wound, to keep you can keep bacteria out, basically just to keep it clean. All right, so what you would do is you peel this off, and it's basically it's thin. It's about the thickness of like what you'd expect skin to be. And so I don't know if you can really tell in the video, but it's like really, it's a thin layer. And so if you have road rash, you have a burn, whatever, you can apply this on top just to keep it protected from anything, okay? It's supposed to be waterproof and all this stuff. And so let's just say right here. All right, so you would attach it. You can use this window for seeing where the wound is. You attach it, and you peel this off like this. And again, you can use this for burns, for different things. And you can tell how thin that is just like that, okay? And so it just helps keep whatever wound you have, the wounded section, helps keep it clean, helps keep water out. Like you take a shower and you don't have to worry about, getting water or soaking your bandage. All right, and so, yeah, there we go. So you can tell, like I said, how thin this is. All right, I'll toss it to the side. And some more smaller, non-adherent pads. It's always advantageous to have different sizes with the different bandages, gauze pads, and all that stuff. All right, let me go ahead and stop right here because what I should have started with is I have nitrile gloves. All right, anytime you're working with somebody else's blood, or any blood, to be honest, you're gonna want to have some nitrile gloves that you can snap on. Okay, not snap on, you can pull on, or you can use those, and it'll keep you protected and maybe them protected from you from if your hands are dirty, okay? You don't have time to go wash your hands before you start treating somebody's bleed. And so being able to pull on these nitrile gloves, they'll keep your hands mostly clean, let me say, because you have dirty hands and you're putting it on, you may get them dirty anyways. But it's better than not having any gloves. And so I like carrying 2 sets of gloves. So I have one here, because it's always good to have somebody to help you, okay? And so let's say you're treating a bad bleed, okay? You get started, you put on your, whatever you're gonna be using here. Let's say you're using this quick clot sponge, okay? You're using it, you're applying pressure, and you have somebody close by, you're like, hey, put on these gloves, come put pressure on this while you get, some gauze out to actually wrap it up, right? So I like having 2 pairs of gloves. And something else that I like having is this little snap light. The snap light, it's not gonna be super bright, but it'll give you enough light to where you'll be noticed, and it can provide enough light. So I'll snap this, shake it up, and now this is supposed to provide light for, I think it says up to 12 hours right there. All right, so it provides up to 12 hours. Let me turn off this light right here and this light over here. All right, so you can see it'll help you. You can hang it up. You can whatever you want, and it provides light. You don't have to worry about batteries running dead, and 12 hours is more than enough time. And again, like I said, if you're at a car accident, you can toss this out there so people are seeing you. They see there's something happening up ahead. All right, so those are snap lights. All right, so that's the gloves. That's the snap lights. I'll take this over here. All right, next up, continue where we were. These are locking forceps. And these are nice whenever you're trying to clean up something, and let's say you have some gauze. You grab this gauze again. Of course, it's really large. You can snap down on it, and it holds it in place. All right, and so again, like I said, this is really large. I wouldn't use something this big. But if you say you're cleaning something up, you don't have to worry about dropping it or whatever else. These can also be used as hemostats, which I don't know if I'd use these or not. But basically to pinch off a vein. But that's not for basically our level of medical training. All right, so locking forceps. And over here I have some really fine tweezers. These are good for getting to really small splinters and whatever else. All right, so you can see how thin the tip is. Then I have some splinter out. Splinter out is basically just a piece of metal. I'll go ahead and open this up, let you see it too. And it's just really sharp, and it's good for picking at splinters, for getting out. Again, go back to road rash. If you have like a rock under your skin, it's good for picking at it, getting it out. You can use the tweezers and all that. All right, so this is that splinter out. This is a small little surgical blade. Again, it can be used for cutting away dead skin, cutting to stuff. And so, all right, like I said, assorted Band-Aids, different sizes. You got small round ones. If you go online, you can find literally a box of assorted Band-Aids with different sizes like this. And I like to keep things, so like next to my Band-Aids, I like to keep a triple antibiotic ointment, right? Because that's what you're gonna be using on, even if it's a smaller cut, you're gonna want some antibiotic ointment. And I like these single-use little packages because you don't have to worry about opening, closing, and maybe using the exact same. Like right here, I have a tube of Neosporin. Neosporin, I'm sorry, Neosporin. And so this takes up a lot of space in the pack, but also if you're applying this to one person, I know you usually apply it to the bandage, but nonetheless, you multiple uses with this, where this is a single use, and so I use it once and I toss the package. And so I like having the single use ointments and other creams like that. All right, then we have some more Band-Aids. These are long, like for your finger. You have like knuckle Band-Aids, you can kind of see them through there. Knuckle Band-Aids, some like fingertip Band-Aids. So like I said, just some assorted different Band-Aids. A Band-Aid for every boo-boo, I guess, right? All right, let me go ahead and fold this under to give ourselves a bit more space. All right. This is a SAM splint. If you don't know what a SAM splint is, it basically has aluminum down below, and it's wrapped in this foam, soft foam. And you can fold it, you can roll it, however you prefer. I like it rolled in mine. And this is used to make a simple splint. Right, and I have here, because I'm short on space, I have a half of a roll. And so actually these are usually even longer. What this is used for is, let's say, you got a broken arm. And what you want to do is you want to immobilize it. So you would form the aluminum down below, kind of like this, so it would fit on the arm. All right, and so this makes it stiff, you can see. All right, so it makes it nice and stiff. And you can wrap this and you can bend it as needed so it'll fit right up next to the arm, like that. And what you would do is, once again, going back to our gauze, you just take and you'd wrap the gauze around this. Again, not easy to do this on yourself. All right, about like that. I think you guys are getting the idea, right? All right, so you'd wrap this around and you hold the splint in place. That way your arm, if it's broken, it's immobilized. All right, so that's the SAM splint. Like I said, some people like them folded, some people like them rolled. And so however you prefer to store it. I'll just fold it up for time's sake. Just like that. I've actually seen these be used before also as a neck splint. It's not called a neck splint. I can't think what it's called. Anyways, like after whiplash, you see people walk around with the big pill around their neck. I know someone's gonna correct me for the name of it, but anyways, you can use this for around the neck, just kind of keep your head a bit also immobilized, like after whiplash. All right, go put that aside. Next thing I have some Neosporin spray. And this is convenient because, like I said, it's a spray. And so it doesn't take up much space, and you can just spray it onto the wound. And so you don't have to worry about applying it or anything like that. So this is kind of nice to have. Also some Benadryl itch relief stick. And so if you've been bit by mosquitoes, or if you have an allergic reaction to a plant or whatever else, you can use this, and it's a topical analgesic. Yeah, anyways. It's got anyways, it's Benadryl, okay? What you do is the tip becomes saturated as you push on it. So you can see right there already. And you just basically, you'd apply it. And it helps with the itching, all different kinds of reasons of itching. And then down below I have a submerged thermal blanket. And this is good for whenever you have somebody in shock, somebody's cold. Using the blanket is always good for treating shock. All right, up top we have, this is liquid skin. And you can apply this on top of a wound, kind of to really seal it up. It creates literally, basically like a second layer of skin on top of the wound, just to kind of protect it from water and all this kind of stuff. Because if you worked before with Band-Aids, the Band-Aids become wet, they come off, and you eventually just throw them away because they're more of a hindrance than a help. All right, these right here are Rescue Remedy. Okay, it's called Rescue Pastilles. Anyways, and they are good for when somebody's in panic. They are like a little gummy that you can suck on, and they have some natural different like herbs in them that kind of help you just kind of relax and calm down. So I've used these actually several times, and I really recommend them. They really help calm you down. All right, then here we have some instant hand sanitizer. Again, that's self-explanatory. This is an ammonia tablet, and whenever somebody has they're unconscious, this is used for bringing them back. Basically, you open this up, you let them sniff it, and okay, it wakes them up. Here I have aspirin. Again, if you notice, I have it up top, separate from my other, like where the rest of my pills are, or over here in this mesh side. I have the aspirin separate because aspirin is often used for when you have heart pain, chest pain. Right, so I have that readily accessible up here up top. Then here I have this iodine. It's a prep pad. Then some alcohol prep pads. They're good for cleaning up a wound, for preparing it if you're going to be applying like a sticky bandage. This will help you get the oils off the skin. It kind of helps the bandages stick better. All right, some wet wipes. And so again, self-explanatory. If you've treated somebody, you have blood in your hands, you're going to want to get that off. I've been in a situation where I was called because somebody was working at a construction site and they had a circular saw that they tripped with. And the circular saw, while it was spinning, landed right here at like the inside of your elbow. And so it cut across this large vein, cut into the, the tendon was cut. And so the person was standing there, he was already in shock. And so he was literally spraying blood. The walls were already all spray painted with blood. And so I came down and treated that. And basically just, with pressure, with some gauze, I applied pressure. We got him to the hospital. And it wasn't until I was at the hospital, I looked at my hands and I had literally gloves of blood where they just dried into my hands. And so after you treat a bleed, you don't want to get your hands wiped up the best you can. And so I have some wet wipes. I have a second one, but it fell on the floor. All right, the next interesting thing to show, this is an Israeli bandage, and it's also used for large bleed. And now this here, on the back, you actually have instructions for how to use it. But you want to know how to use it before you need to use it. Because when somebody's bleeding out, and they've got like 2 to 3 minutes before they bleed out, let's say they've cut their femoral artery, they don't have much time. You don't want to be sitting here looking at the pictures and trying to learn. Then you want to know your gear. You want to know how to use it before you need to use it. All right, so like I said again, this is called an Israeli bandage. And I'll go ahead and I'll demonstrate how this is used. Actually, if you see right here the red spot, they intentionally, because whenever you're treating somebody for a life-critical wound, you don't want to be looking for scissors. And so they have very conveniently marked red everywhere where you can rip and pull. So the top, over here. So you pull that and it comes open. All right, so once again, I'll show this on my arm simply because it's only going to really get into the picture here. But this can actually be used in many places. This can be used on your neck. And so if you've been cut in the neck or shot, you can actually use this where you'd put the bandage side on the wound on your neck, and then you'd wrap it down under your armpit. Okay, because you don't want to wrap it around your neck. Obviously, you're going to be cutting off your air and your blood to your head. And so you'd go from your neck to your armpit. You can use it on your leg, on your abdomen. So anyways, it's a very nice piece of equipment for this survival kit, this trauma kit. All right, so you can see right here is the large absorbent pad. And so what you want to do is, again, like I said, I'll use my arm as an example. You want that on your arm, okay? And if you notice right here, kind of a cool thing, so this doesn't come unraveled while you're working, they have a string in there. Right, so you can easily pull this like this. So I just get off right there. You pull it around. All this material is really thick, and so that's what you want whenever you have a bleed. Is you want to have the large, thick, absorbent material here. All right, and what you do is you can wrap it around as many times side to side, depending on how large your wound is. I'm just going to go one time around. What you do is you go in through here like this, and then you pull the opposite direction. So you want this plastic section right here to be directly over the wound. So let's say my wound is right here. That's where I want this plastic piece to be. All right. Then you pull the opposite direction like this. All right. And it applies pressure directly to that section right there. All right. Like that. Then you'd continue wrapping it around the wound. And I'm going to go ahead and keep wrapping it to the end because there's one last thing to show. All right, and you can see already how thick this is on my arm. And that just is an example to how much absorbency it's going to have. All right, and then at the very end, what you're going to find is this plastic piece. And you can hook this in over here, like this, and up top. Once again, this is not as easy attaching it to yourself as it is to somebody else, but it's a good skill to have because you may be in a case where you have to treat yourself. All right, so that is staying in place right there. And I can feel the pressure where it's right on the wound. And so it's applying pressure right where I need it to be. You know, if, for example, my wound was right there. All right, and then this can be removed, loosened up, tightened up as needed. Wow, that thing doesn't want to come off now. There we go. So it's got teeth basically right here. That's the reason why. Let me pull it up, you can see. It's got teeth right there. Not wanting to let it go. That's good. That means it's not going to get away, not going to come loose. All right, so that is the Israeli bandage. And that actually, if you noticed before I took it out of the package, that was in a very compact size for that amount of bandaging. So a very nice thing to have in your trauma kit. I really recommend having that. All right, then I have some safety pins. You can use these for setting up a, I keep forgetting the words, a sling, basically. You use this for set up a sling. A lot of different uses for that. And then last thing here is we'll get into this last section. So I have more of this gauze that is self-conforming. I like working with that. All right, and then this here's for treating some more smaller, minor things. This is Sting Kill, and if you haven't seen this before, this is amazing stuff. If you've been stung by a bee, I've seen people who you'll see they've used it for like more serious stings, like even like a bullet ant or some different people. Anyways, this Sting Kill is really good stuff, and I'll go ahead and I'll show you how it works. What it is inside you have this little glass vial, and you snap that glass vial, and you push, and the tip becomes saturated with the medicine, like that. And you would basically just apply it to. I've used this for mosquito bites. I've used it for a wasp bite, and it literally it gets rid of the sting. And so this stuff is really good to have. All right, has some Chloraseptic for sore throat. Eye drops. I have some more eye drops in here. Up top somewhere. All right, this is Dayquil, NyQuil for treating some cold symptoms. They have more Sting Kill. All right, these are the instant wet wipes. They're kind of like tablets. And I've showed this in a previous video before, but I'll go ahead and I'll demonstrate it again in case you did not watch that video. All you need to do is you pour some water on this small little tablet. Just like that. It absorbs up all the water, and you have a wet wipe. If you apply less water, it's drier, and it can be used as toilet paper, as a napkin, and so there you go. That's a really cool thing to have. I carry them in my EDC pouch and several different places just because of the advantage of them. And I have several in this little pouch down below. All right, so you'll see some more of those. In here I have some different creams. I have burn gel, I have some skin lotion. I'll go through these real quick. All right, so like I said, skin lotion, some vitamins A and D ointment. They're good for like dry skin, for chapping. Okay, more burn gel, more burn gel. This stuff is great to use, obviously, on burns. Okay, lip balm. Got some iodine prep pad. Oral pain relief. This stuff is great. If you have canker sores, if you have a sore tooth, it's kind of funny because you'll apply it to, let's say, just your lip where you have a canker sore, and it ends up making your whole mouth numb. And so this is great stuff to have. All right, some triple antibiotic ointment. Hydrocortisone cream. This is for itching, kind of like the Benadryl. All right, then some more instant hand sanitizer, burn gel, sting relief, another package of the oral pain relief, and another triple antibiotic cream. Okay, this is I use for tooth sensitivity. And then this is an instant cold pack. And so inside there's something liquid, and there's also some beads in there. And you pop it, and it becomes cold, and so it's good for a sprain or for anytime you need to apply like ice. That's what this is good for. I'd show it to you, but there's no reason for me to pop it. You'd just be taking me for my word that it gets cold. All right, this right here is great. It kind of replaces tape. If you've used this before. Again, it sticks to itself, and so if you have a cut or whatever on your finger, you need to wrap some gauze to it. This is great because you don't need to use a tape. All right, some medical tape. And here's some cotton. You can use it for a lot of different uses. All right, a small little thermometer. This is sniffing salts. Again, it's got the ammonia inhalant, and so whenever somebody's unconscious, use this to wake them up. More of the Sting Kill. Some more of those tablets. Again, more eye drops. They have some Pepto-Bismol. This is good for if you have upset stomach and a lot of different stomach problems. This kind of helps calm your stomach down. And I have some assorted pills through here. Some antacids. Again, some different medicines here. Some Diatame, sinus pain and pressure. I realize that some of this stuff is a bit repetitive, but it's okay. Got some Medialyte for whenever you are dehydrated. It helps get you back some of those needed salts. It's cramp tabs, back pain off, non-aspirin, and some other. Okay, some stuff for allergy, chlorophene, and so on. All right, a little pocket knife, just in case it's needed for cutting things. And if you haven't seen this before, it's a really simple little Chinese knife, but it folds up. So it's like a card, and then it opens up to be a little pocket knife. So it's kind of nice that it doesn't take up much space. And I put it in there in case it comes up needed. All right, some more Benadryl. It's for treating allergy. Also great to have. What I did is I wrote down a small list of different medicines and what they're meant for. Just in case I forget what kind of medicine is for what, and that kind of helps. All right, then I have some Advil. And again, like I said, I like having these things in individual packages that make it really easy to pack. And I have, this is similar to this. It's a self-adhering wrap. I don't remember what the exact name of it is. All right, so again, like I said, it's instead of tape, you can put a gauze bandage on a wound and then wrap it up with this, and it does not want to come off for me. Anyways, like I said, it's self-adhering, and so yeah, and no fingernails. All right, anyways, I'm not going to bore you with that. It doesn't want to come off. It's the same concept as this right here, where it sticks to itself. All right, so that is all for this medical kit, this trauma kit. And so hopefully that was helpful. And Okay, once again, this is what I carry. Kind of made a mess here. This is what I carry. What you carry may be different. You know, you may say, hey, you should have included a face shield, you know, to keep from blood from spraying your face. Well, you know, I got to keep in mind that I want this all to fit into a bag that if I need to, I can put on my belt and take with me. And so, yes, of course, there are other things that you can carry for medical reasons. But this was basically what I chose to carry in the amount of size that I had. And so let me know what you think about this whole trauma kit. And thanks for watching. Don't forget to subscribe.